Check one, two, check one, two. Good afternoon, everyone. We are a minute late by official time, but the clock in the room says that we are on time. So welcome to this afternoon's Public Health Committee meeting. And I would like to convene our meeting and just say we have bills referred from other committees to us today, which obviously have been heard elsewhere and primarily debated elsewhere, and we will discuss some of them here today. Before we begin, turn it over to you, Senator Almore.
Thank you so much, Madam Co-Chair. I think we had asked other committees to send bills to us because we are missing our colleagues. We have had so many intense conversations. So we said, well, might as well see you all because I was having withdrawal. So good to see everyone. Thank you.
Thank you very much. Representative Claire DeCipria.
Hello, everybody. Sorry I can't be there in person, but as you can see, I'm at work. Let's get going.
Thank you very much, Representative. And I think, nope, missing Senator Summers today. Okay. The first item on our agenda today is House Bill number 5142, file number 84. This is an act concerning the use of technology for virtual visitation and monitoring in nursing homes and residential care homes. Is there a motion?
So move.
Is there a second? Moved by Senator Amwar and seconded by Representative Belton. As I mentioned, this bill was referred actually from the Aging Committee. It comes to us as essentially an extension of what's already been done in nursing homes, and it extends to residential care homes the protections and requirements for virtual visitation and monitoring. And in addition, it makes it a Class B violation for a facility to hinder a resident's ability to lawfully use virtual visitation and monitoring technology. And I will say that my understanding is that this bill will continue to change as it moves through the process, that there are some amendments that the Aging Committee leaders are continuing to work on. So I believe that the bill before us continues to be a work in process and in progress in both ways. Is there discussion on this item? Senator Amwar.
Thank you so much, Madam Chair. Madam Chair, I just wanted to raise a couple of concerns. One of them is that there are operational concerns and privacy-related concerns. So while we may vote this bill out of committee today, this is not a bill that's ready because we have to make sure that some of the privacy-related concerns are going to be addressed. We obviously want people to have the visitation, but we also want to make sure that their privacy is protected at all times. Thank you.
Thank you, Senator Amwar. Is there further discussion on this item before us? Seeing and hearing none, Madam Clerk, would you kindly call the roll?
Thank you. Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vehy,
McCarthy-Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Senator Marks votes yes.
Senator McCrory, Senator McCrory, Senator Summers, Senator Kildaris Dietrich,
Representative Claire DeCipria votes yes.
Representative Berger Gavarlo, Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes yes.
Representative Dolphine,
Rep. Dauphiné votes no until I see the changes.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Jenga,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Gordon.
Senator Gordon votes yes.
So sorry, Senator.
No problem.
Senator Hakkadel, Representative Gavras de Gore, Representative Kit,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Mara,
Mara votes yes.
Representative Martinez,
Yes.
Representative Morin Bello, Representative Parker, Representative Paletta,
Paletta votes yes.
Senator Rahman, Representative Reddington Hughes,
Yes, with the hope that I can still retain that yes after it's changed.
Representative Romano, Senator Slapp,
Senator Slapp votes yes.
Senator Steinberg,
Representative Steinberg votes yes.
Representative Zupkus,
Rep. Zupkus votes yes.
Representative Senator McCrory, Representative Caldris Dieter,
I already voted, didn't I? You called me senator the first time, so.
oh, yes, you did. All right, forgive me. Representative Berger Givarlo, Representative Elliott, Representative Carvers de Graw, Representative Senator Kushner, Representative Morin Bello, Representative Parker, Senator Rahman, Representative Romano. There ends the calling of the roll.
Thank you very much, Madam Clerk, and the votes will be held open until 4:30 today. So next on our agenda is item number 2, substitute for House Bill number 5299, file number 93, an act allowing trained assisted living aides to administer medication to assisted living residents. And this is referred from the Aging Committee. This will be a JF to the floor. May I have a motion? Moved by Representative Kit. Is there a second? Seconded by Representative Belton. This bill will do much as the title says. It will authorize registered nurses to delegate the administration of certain medications to assisted living aides who are trained in medication administration. It will require the Department of Public Health to adopt related regulations, and it also provides protections for the nurses who delegate. And they're generally immune from civil liability, though not so if their negligence is found willful or wanton. Is there discussion on this item before us? Representative Martinez.
Thank you. I just wanted to make a comment that I do have some concerns with this bill as written. Right now, it gives the RN the ability to delegate. I think that can be confusing as supervisors do change throughout the course of the shifts. Having the RN delegate to the med techs who's giving what med what day. I wouldn't want to see any patients fall through and not get their medication. I'm concerned about the lack of discussion in this bill about what training, what retraining, and original education about how DPH would enforce this. And there is a lot of language about safety protections for the nurses. I'm just not seeing the protections all the way there for the patient, and I think that needs to be the number one priority with this bill. So as drafted right now, I would be voting no. I did look over again today too to see any new testimony that was put in. And I did see the Connecticut Assisted Living Association opposed, the commissioner opposed. Yeah, so I do have a lot of concerns with this bill. Thank you.
Thank you, Representative. I will just add that there is a lot of discussion, as I mentioned on the last bill, related to this bill as well in terms of significant modifications that are likely to be made. And I know that there has been conversation among the proponents and the leadership of the Aging Committee, as well as some of the folks at DPH and some in the nursing community to try and narrow the scope of the bill to potentially just look at over-the-counter topical medications and eye drops. Those were the conversations that are ongoing. We don't have that as amended language here today. So the bill that we have, again, is a work in progress that would be something that would be likely amended if it was to move forward. Other discussion on the item. Representative Reddington Hughes, to be followed by Representative Mara.
Oh, through you, Madam Chair. So it's my understanding that the bill that we're voting on today would allow these med techs to give prescription drugs out, not just the over-the-counter type. I mean, that was what had been discussed before. Through you.
That's correct. That's my understanding as well.
That seems like a different bill. Yeah. Thanks.
Thank you, Representative. Representative Mara, to be followed by Representative Dauphiné.
Thank you so much, Madam Chair. I actually really love the idea of this bill. I think that, it's not rocket science making sure that people get their medicine. Certainly there's training that can be involved to do this. But kind of the same lines as kind of Representative Martinez said, I just would like to know where the ownership of it, who ultimately is responsible for anyone getting their medications. And to me, it doesn't matter whether it is prescription or over the counter. Some of those can be very much needed by anyone. But the ownership and understanding of who has ultimate ownership, I think, is my concern.
Thank you for your comments, Representative Mara. Representative Dauphiné.
Thank you, Madam Chair. So I can just have clarification. So I'm okay with the bill the way it is, but you're anticipating that it's going to change?
Yes, that's
Okay.
my understanding.
That's where I struggle, because when I know you're planning on a change, I like to vote with what's before me, and when they're already, that was my problem with the last bill. You're already declaring there's going to be change. So if I know there's going to be change, I'm going to be a no, but I'm overall okay with this bill. Just don't know what the changes are going to be. So I'm going to vote no. Thank you.
Thank you, Representative. And just to clarify, the bill would be JF to the floor. It would then be the Aging Committee that would be making those changes. So I can't sit here today and guarantee exactly what that language would be. Oftentimes when we have bills in public health, we have a sense of where those conversations are happening. I'm not having those, Senator Anwar and I are not having those direct conversations, but we've had a number of conversations with the people who are. And I think that's because of some of the concerns and questions. That was the direction I wanted to just share that openly with people, that I am understanding. So I should also say that we do allow this, there are 38 states that allow this to occur, and there are places in the state that we already do have this in place. I think as Representative Martinez referenced, there were some concerns about the construction of the bill that would make sure that we had some of those safeguards in place. And that's part of that ongoing conversation.
Thank you, Madam Chair. I do appreciate the transparency. I just want to vote with, if you're saying there's going to be changes, I would be a no. But thank you, not knowing what those are going to be. Thank you.
Thank you. The vote today is on the bill that's before us as it is. Senator Anwar, to be followed by Representative Kennedy.
Thank you so much, Madam Chair. I just wanted to share a few of my thoughts about this bill. I also have concerns about the bill, and I'll share some of them. One of them is that this is a very purely pretty much a public health committee bill. There are very important aspects of this which are related to public health, and I'm glad we are having this conversation, but I would be even more glad if we were having discussions in advance. This bill has an inherent flaw in it, in my mind. The flaw is that that suggests indirectly that the only thing a nurse does is that they provide medications to a patient, which is far from the truth. When a nurse walks in and sees a patient, they are assessing that patient in a depth and detail, which assesses where they are, what's going on, what's the difference. It's a much more clinically focused assessment. And they are seeing if the patient is as alert as they were before. They're seeing a pattern. They're actually looking at so much more than just providing a medication. And then they're looking at the patient's ability to swallow, the patient's ability to move. There is an indirect assessment happening every time a patient gets the medicine. And so to minimize it, just that we would have another individual, and we use the word trained, yes, but they're not going to be trained like a nurse is. And there's across the country, there's a pattern where more and more healthcare facilities want less trained individuals to be providing care. And that's because of the shrinking dollars at times, or the cost of providing care is getting more expensive. But the litmus test for many of us should be that the person in that assisted living is like our family member. Do I want my family member to receive a care from a person who does not necessarily know the side effects and the effects of the medicines, how many need to be taken, and if they are just going to be given the medicines that are being identified? We know, and it's well recognized, that the medication errors are a very big part of healthcare systems problems. And while we are trying to obsessively figure out how to prevent that from happening, this bill moves us in a different direction. It is taking us in the direction from having far less trained individuals to be providing the care and providing the medications. We are reducing the opportunity for assessing the patient. We are also reducing the probability of patient issues that need to be addressed. Yes, we have a shortage of healthcare workers, but we have been working around this committee to be able to address that. We have a nurses compact we have been able to work on, which is actually now implementing. There's so much that is happening. I think if my loved one is in the facility, I would want a nurse to give them the medications, and therefore, Madam Chair, I would be a no at this point. Thank you.
Thank you, Senator Anwar. Representative Kennedy.
Thank you, Madam Chair. I do too, I as well have a lot of concerns with this bill. As it's been stated, it does make sense, and certainly we want to make sure that individuals that are in need of their medication certainly are getting it in a responsive manner. And you've indicated that it is a work in progress. It's going to be a number of changes. One of the changes, I'm looking at the summary, the bill summary, and it states that the Public Health Department, the commissioner is going to adopt related regulations. And I also note that in this bill, the effective date is October 1 of 2026. That's a fairly short window to adopt different regulations. And I wonder if that's something that can be attained. There's other parts of this, but certainly it is a bill that certainly makes a lot of sense. I am going to be a yes out of committee and reserve the right to change that vote when this bill comes to the floor. As it's indicated, we're not the ones that are going to be doing the work. This is going to be sent back to aging. Is that correct, Madam Chair? Through you.
You are correct. Well, it will be referred to the floor.
And then
it's-
go
as
back to
it's an-
aging.
Yes, as it's an aging committee bill,
Okay.
it will be the leadership of the aging committee that would then shepherd that bill through the process.
I'm going to trust in that this will go to aging and that they will get the work done, and a lot of the issues that so many of us have today will be addressed But again, reserve the right to change that vote when in fact this comes to the floor. Thank you, Madam Chair.
Thank you very much. Representative Clara DeStitria to be followed by Senator Gordon.
Thank you, Madam Chair. I'm hoping some of the changes that may eventually happen to this bill will make it a little stronger, because I do truly believe that this bill is about timely care, smart staffing, and responsible oversight. I'll be a yes today, but hopefully the changes that will be made will be a positive change and will just strengthen this bill. Thank you, Madam Chair.
Thank you, Representative. Senator Gordon. Senator Gordon, if you could unmute yourself, we can.
Thank
there
you, Madam Chair. I'm going to be a no on this bill because I do have concerns in general, and I think this is an example that highlights concerns I know I and others at times have raised, that when we try to expand a scope or work that certain people in the healthcare field do, that others are trained to do and actually do that work, that can be a concern. And this is just one example of it. I think there's a number of potential concerns with this bill, especially as written. And again, this is another example that when we look to try to legislate expansion of things beyond people's training in the healthcare world, and different types of jobs in the healthcare professional world are not interchangeable, then that becomes potentially a number of problems, including patient safety and other issues. So because of that overall concern that I continue to have in general, and also some of the specific concerns about this, and knowing it is going to be undergoing further changes, I'm going to vote no on it. Thank you.
Thank you, Senator Gordon. Is there further discussion? Representative D'Amico.
Thank you, Madam Chair. Yeah, I would like to align my comments with those of Representative Martinez, Senator Anwar, and Senator Gordon. While I would like to vote yes for this bill, there are too many concerns that have been identified by my colleagues, and certainly some significant concerns that were outlined in the testimony that this committee received regarding the fact that medication administration is not a simple task. It's a complex process that requires critical knowledge and skills, and there are just too many things that could potentially go wrong. And I would like to vote yes. I would like to assume that this bill will get better down the road, but there is no guarantee that that's the case. So as I traditionally do, I vote on the bill that's in front of me today, and the bill that's in front of me today is fraught with problems, in my opinion. So I'm going to have to be a no. Thank you.
Thank you, Representative D'Amico. Representative Reddington Hughes. Oh, through you, Madam Chair. I do too have concerns with this because this was not the original intent. I believe that the original intent was to have the med techs able to give out medications that were non-prescription. And I certainly am not saying that the non-prescription medications are without effect as well, but I think that that was a different bill. I understand that in many of these assisted living communities, there is a staffing problem as far as, nurses and other folks to be able to distribute everything. So initially, I thought that this was a good idea with the non-prescription drugs being able to perhaps get people things in a more timely fashion. But as it is stated today, I would not be in favor. Thank you. Thank you. And just to assure that there's no confusion, I was sharing the conversation about the bill. The vote before us today is on file number 93, and this bill defines medication, which is any medicinal preparation and includes any controlled substances specifically designated in the regulations adopted pursuant to subsection D of this section. So I just want to make that clear. I know bills do often change, in fact, usually change through the process, but just to make sure that everyone is clear about the vote today. And I will also share that, as committees, we each have different roles and perspectives. Here in public health, I'm thinking today about those astronauts who are up on the moon and perspective. I've been thinking a lot about that this week. And so I recognize that we may approach these issues differently as we come at it from our various perspectives and look at legislation. Seeing and hearing no, and actually before I do that, I'll make one other comment. I have some concerns myself. I do intend to vote yes to keep this conversation moving, but I understand and recognize the concerns that we've heard from some in the nursing community and elsewhere. So with that, Madam Clerk, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes no.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes to keep the conversation going.
Senator Marks,
Senator Marks votes no.
Senator McCrory, Senator Summers, Representative Clarice Dietrich,
Representative Clarice Dietrich votes yes.
Representative Birgit Javarlo, Representative Biggins, Representative Carpino,
Representative Carpino votes no.
Representative Dolphinet,
Rep. Dauphiné votes no.
Representative D'Amico,
D'Amico votes no.
Representative Elliott, Representative Jenga,
No.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Senator Huckadell, Representative Tavros DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy is yes out of committee.
Senator Kushner, Representative Mara,
Mara votes no.
Representative Martinez,
No.
Representative Morin Bella, Representative Parker, Representative Paletta,
Rep. Paletta votes no.
Senator Rahman, Representative Reddington Hughes,
No.
Representative Romano, Senator Slapp,
Senator Slapp votes no.
Representative Steinberg,
Representative Steinberg votes no.
Representative Zofkus.
No. Rep. Zufkus.
Here ends the calling of the roll.
Thank you very much, Madam Clerk. And again, votes will be held open today until 2:30. And with that, we have concluded the business of our meeting. 4:30. I said 2:30, didn't I? Thank you. This is why you have such amazing vice chairs like Representative Belton. The votes will be held open until 4:30. And thank you all for being here today. We appreciate it.
Isn't here. Good. Isn't here. Isn't here. No. That's it.
Hi, Madam Clerk. Would I be able to cast my votes?
Definitely. Senator Summers,
Okay, so for number one, you tell me when you're ready.
for HB 5142,
Yes.
HB 05299.
05299. I don't see that on the agenda.
5299.
Oh, I'm sorry. I thought you said 05. I'm a yes on that.
Hold on. 5303. Senator Summer.
Yes. I'm a yes.
Wait, hold on. So we took a break a while?
We only voted on 2 bills.
Okay. We only did 2 bills, Senator Summers, so you have completed your votes. Thank you.
Okay, we didn't do 5316.
No,
No, we only did 2,
item 1 and 2.
item 1 and 2.
Okay, but then I just voted on 3. So are you just getting rid of that one?
Yeah, thank you.
Okay. All right. Thank you so much.
Thank you.
Bye-bye.
Yeah, academic, yeah, academic.
Representative Elliott.
Hello.
We have the 5142.
Yes.
And we have HB 5299. How do you vote?
Yes.
We only did items 1 and 2.
Hmm.
So you have concluded your vote for today, right?
Yes. All right. Thank you.
You're welcome.
Summers and Thursday. Okay.
Summers is on.
They're both on. No, I'm asking her about the name.
Oh, okay. Senator McCrory,
It's me.
can you hear me, Senator?
Absolutely, I can hear you. Can you hear me? Hello? Hello?
I'm hearing you.
Can you hear me? Can you see me? Can you see me?
Go again, Senator McCrory.
Hello? Hello?
I can see you, Senator. Please hold a second. Thank you.
Yep.
This was not a government bill, this is an agent bill, a good agent bill.
Diane, you're on mute.
I'm sorry, Bev. Senator McCrory,
Yes. Hello? Can you hear me?
Senator McCrory.
Yes. Yes.
Okay, there are two bills for you to vote on. Item number 1 on the agenda, House Bill 5142. How would you like to vote?
In the affirmative.
Thank you. And item number 2, House Bill 5299.
In the affirmative.
Thank you, sir.
You have a great day and a pleasant tomorrow.
Same to you.
I don't know what the problem is going on.
Higher level computing allows for a higher budget, allows them to stabilize and stay, yeah. In the system.
Where is she?
I think you should, because there's enough of a gap, as you say, between nurses and what we're currently paying for the care plan.
Representative Marin Bello?
Close that gap and still see someone in that assisted living comfortable.
Hi. Hi, Representative Marin Bello. We have 2 bills for you to vote on today.
Yes.
The first is HB 5299.
I am voting yes on that bill.
Could you please repeat?
Yes, I am voting yes on that bill.
Right now, he's not allowed. Right now.
And we have HB 5142.
And I am voting yes on that bill as well.
Okay, thank you so much.
Thank you. Have a good day.
You too.
Bye-bye.
PSS to create a better upland, update those characters. That's thing one. That's where we agree with him. Where there's more.
Hi, Bev or Diane.
How are you?
I'm good. How are you?
I'm doing well. Give me a moment, please.
Sounds good.
Diane, may I have the tally sheets?
Bev, do you happen to know how many people are on public health?
How many people are what?
How many members there are on public health?
I think 30 something.
30 something. Okay.
Yes. I'll let you know shortly. We voted on two bills on the agenda. I think you voted on item number 1.
I did. Yes.
Second bill is item number 2, House Bill 5299. How would you like to vote?
Representative Bagans votes no.
Thank you, sir.
Okay. Have
Okay.
a wonderful day.
Same to you. Bye.
Bye-bye.
Hi, Beverly. When you're ready, I'm ready to vote.
We voted on item number 1 and item number 2 on the agenda. How would you like to vote on item number 1?
On item number 1, I am a yes. And on item number 2, I am a yes to continue the conversation.
Thank you very much.
You look lovely in pink. Have a good afternoon.
Same to you. Thanks. Bye.
Take care. Bye-bye.
Now, why do you think?
Can you hear me?
Yes, I can hear you. Can you hear me?
All right, you're fixed.
Yes, ma'am.
Can you hear me? On there?
Yeah, but what was under? What do you mean? I heard it last time.
Can you hear me?
Senator Rahman, can you hear me?
Yes, hey, how are you?
Okay, I'm gonna need to see you, sir. Thank you.
Yes.
So Senator, we had two bills for you to vote on today.
Okay.
It's HB 5299.
Mm-hmm.
How do you vote on that, sir?
How about the Senate chair? They voted yes.
This is
Senator Anwar voted yes, or
yeah.
I can hear you. Can you hear me?
Okay, hold on, Senator.
Okay.
Sorry, Senator.
It's okay.
Yeah, so HB 5299. Oh, you did ask how Senator Anwar voted.
Yes.
He was a no on this.
So he voted no.
But we have various votes either way.
How about the House chair, Makortibe? She voted yes.
Yes, she voted yes to continue discussions.
Okay. What if his Senate chair said no? I said no. My vote no.
Okay.
You there?
Yes, I'm hearing you.
Okay.
HB 5142.
Mm-hmm.
Chairs are yes.
So Senate chair, how he voted?
Both voted yes.
Okay. All right then. Yes. I voted yes.
Okay. All right. So we did two bills today, Senator. So your votes are complete.
Awesome. Thank you so much. Appreciate it.
You too. Have a great day.
Goodbye.
Senator Kushner, can you hear me?
Yes, I can.
Hi, I see you're traveling, Senator.
I am.
We have two bills for you to vote on. It's HB 5142,
Can you read the title, please?
an act concerning the use of technology for virtual visitation and monitoring in nursing homes and residential care homes.
Senator Kushner votes yes.
And we have HB 5299. It's an act allowing trained assisted living aides to administer medication to assisted living residents.
Senator Kushner votes no.
Okay, thank you, Senator. Your votes have been noted.
Thank you.
Have a great day.
You too.
Representative Parker, how are you?
Good, how are you?
Very well, thank you. We have two bills for you to vote on. It's HB 5142
Yes.
and HB 5299.
Yes.
Thank you so much, Rep. Parker. Have a great
Thanks,
day.
sir. Bye-bye.
Thank you.